Well, hello, welcome to Kudu Buku. On this channel, we like to go over practice exams, and this way you can get really pumped up and excited. So when you take your actual exam, you're not nervous and you don't have anxiety at all. This is just to help you basically work through an exam, practice yourself, test that information that you've studied so far, and see if you've actually got it down. And this is also for those that are just listening and want to follow along, and maybe you're in your car, on your way to school, or you're commuting, walking to class, and you just want to run through some practice questions and just listen to it without having to read it. This is also available as a resource just to help you study because I've been there and I found this super helpful when I would do this for myself. So I've decided to do it for other students as well to help them be successful in their learning journey because I want people to get this information down and it can be difficult. And A&P, let me tell you, can be very overwhelming. So let's dive in. Okay, so this is just going to be simple 10 questions, and this is going to be talking about anatomical positions. So, first question, what is the anatomical position? A, standing upright with arms at the sides. B, standing upright with arms raised overhead. C, lying down with arms at the sides. Or D, lying down with arms raised overhead. So give a little bit of time to answer that. And if you said A, standing upright with arms at the sides, you would be absolutely correct, which makes a lot of sense, right? We want a position that's going to be logical and that we can understand when we look at it and be like, oh, okay, now we know what we're all talking about. Perfect. Number 2, moving on. In anatomical terms, where is the anterior side of the body? Is it A, front, B, back, C, top, or D, bottom? So where is the anterior side of the body? And if you guessed A, front, you would be absolutely correct. Next question. Which term describes a position closer to the midline of the body? So midline, meaning middle. A, proximal. B, distal. C, medial. Or D, lateral. So this one's definitely using a lot of common sense. Middle line, medial. So correct answer being C, medial. Number 4, the opposite of dorsal in anatomical terms is, if you guessed B, you would be correct. It would be posterior. Okay. If you are looking at a structure that is closer to the surface, it is in a blank position. So something that's going to be closer to the surface, especially if we're talking about the skin, right? You have your epidermis, epi meaning above. So what would be closer in that position? So we have A, superficial, B, deep, C, internal, or D, external. This one's pretty easy. It's going to be A, superficial. And if you were thinking internal, not a bad guess, but it's definitely superficial is the exact term utilized in A&P. So awesome job. And then deep, obviously meaning away from the surface, farther away from the surface. Okay, in which body plane does flexion and extension occur? A, sagittal, B, frontal, C, transverse, or D, coronal? Give you a minute. So, flexion and extension. Which plane is that occurring within the body? So, sagittal, frontal, transverse, or coronal? And if you guessed sagittal, you would be absolutely correct. And moving on. And just so you know, frontal and coronal are both interchangeable in terms of when you're talking about the planes. So that's also a giveaway that kind of helps you narrow it down to okay, sagittal and transverse. So then you at least get a 50-50 chance, which is better than a 25% chance, right? Like it's all about the way you look at it, work through these problems step by step. Okay, number 7, a transverse plane divides the body into A, front and back, B, top and bottom, C, right and left, or D, superior and inferior. So I'll say that one more time. The transverse, basically, it's just asking how is a trans plane divides the body. How does a transverse plane divide the body up? Front and back, top and bottom, right and left, or superior and inferior. And the correct answer to this one is going to be top and bottom. One way I like to remember this one So I always think transverse trannies. So trannies can sometimes have different body parts on the top compared to the bottom of whatever gender they might be identifying with. So tranny, transverse, that's how I always remember it. I think it's a funny way to remember it. So the term ipsilateral refers to structures on A, same side of the body, B, opposite side of the bodies, C, front of the body, or D, back of the body. So yeah, if you hear ipsilateral, you're going to want to be thinking the same side of the body, which is A, correct answer. So yeah, ipsilateral means the same side of the body. If you know what the opposite of that is, it would be contralateral. So contra meaning opposite, against. So ipsil, right, meaning equal. So that's a good way to kind of remember it as well. Okay, number 9. Which directional term best describes the location of the elbow relative to the wrist? So which directional term best describes the location of the elbow relative to the wrist? Is that A, proximal, B, distal, C, medial, or D, lateral? So it's basically asking, is the elbow proximal, distal, medial, lateral to the wrist? And if you guessed A, you're absolutely correct. The location of it would be proximal. Okay, and then number 10. If a cut divides the body into right and left portions, it is a blank plane. Frontal, sagittal, transverse, or coronal. So we talked about these 4 planes again. So if you guessed sagittal, you would be absolutely correct. Okay. And then that leaves frontal and coronal. We didn't really talk about those. That's going to cut the body in the front or the back. So I hope you enjoyed this quiz. Obviously refer back to it and refresh your mind. If there's anything you missed, then definitely go back and study that. And I hope you guys have a great rest of your day and you do well on your exams and you crush it.